everybody. Good morning to you. How are you? So, last night Chantal did a live called Bedbound Arc. She was making fun of the fact that due to her lack of health, she might become bedbound at some point. Anybody who is bedbound, I think they could chime in and agree that being bedbound is not the walk in the park that she's claiming it will be. As a matter of fact, in my opinion, I think Chantal is romanticizing the idea of being bedbound. Perhaps she's imagining a life where she just lays in bed or lays on the couch and food is brought to her and it's going to be so incredibly easy. Chantal, nothing could be further from the truth. Nothing could be further from the truth. And I know that you watch my channel. I know that you watch my content, and because I react to you, you consider me to be a hater. Anybody who opposes what you're doing and speaks out on what you're doing, you automatically label them a hater. Although I have said in my react videos, you kind of got it backwards because the people that are the true haters are the ones that know you have an issue with food and they encourage you to eat. Those are the ones who really don't care about your health. If you are an addict in any sense, if you have an obsession, and there's somebody opposing what you're doing, perhaps in their own way, they care about you because they don't want to see you go down a path of destruction. So, since Chantal, you're on your side of the fence and you have this idea in your head of what being bedbound means, how wonderful it is, I would like to just shoot you some holes inside of your theory and inside your idea by providing some information for yourself or anybody else who might wander onto my channel and might like to know. Now, in the past, I wondered what are the challenges for a hospital, for, say, a nursing facility, or anyone who might care for a super morbidly obese patient at home? What are the challenges? What are the requirements? And I did some homework and I found out a lot. I just pulled up some articles on Google just a few minutes ago, and I would like to share some of that information with Chantal and anybody who might like to know. And then I will let Chantal and anybody else decide, is the idea of being bedbound really something that should be romanticized or thought of as being a good idea? I just wanted to spotlight some of the things that hospitals, nursing staff, even private caregivers, they have to go through and what they have to prepare for when dealing with a super morbidly obese bariatric patient. So let's go to the first article. Let's see. All right. Like these are just things that I found online. Chantal, she could easily do searches and find this stuff out, gather more information. I mean, this is the internet, it's the World Wide Web. Anything you want to know about anything is at your disposal, it's at your fingertips. Before we get into that, though, since Chantal is romanticizing the idea and making it seem like a lot of fun, I have a serious question for Chantal. And it's one she should be asking herself right now. And the question is, Chantal, what if you have a serious medical event or incident at your home and you're by yourself? Salah isn't there. What then? I'm not wishing this upon you, but what if you have a stroke or a heart attack or a mini stroke? Would you have the strength and the time to call 911? Something tells me you wouldn't have the capacity to do so. This is why living alone is dangerous for you. If you have a medical emergency, who's going to be there to call 911 and get medical care to you immediately? Also, I've talked to someone who is a paramedic, somebody in the community, and they let me know that someone who's super morbidly obese, it is very difficult to do CPR on them. It makes things more difficult. So if you were to have a medical emergency you're having a heart attack, you're having a stroke, and it is important to keep that blood flow going from your heart to your brain. That makes their job more difficult to do it. And let's talk about getting the medical care to you as quickly as possible. Most ambulances only have, say, 2 or 3 people in them, max. Given the fact that you are close to 600 pounds, it may take more people to get you from the inside of your apartment onto the stretcher and to the hospital. That's if they have a big enough, say, vehicle. They have a big enough bed. The more difficult it is for personnel to treat you, the longer it takes, the more danger it puts you in. Time is crucial when it comes to a medical emergency. Every second counts and every bit of health counts. So if you are at a size where you are, say, over 500 pounds, it may take somebody stronger to put you onto a stretcher. That might require firefighters who have more muscle mass to accomplish that versus a regular paramedic. So more extra time getting you inside the ambulance. And then once you're gotten inside the ambulance, if you make it to the hospital, it's going to take more time for additional staff to treat you, to put you on another stretcher and get you into the ER. Then, of course, these medical procedures, because of your massive size, it might take extra time to locate veins, to put a breathing tube down your throat. I mean, there's so much. Anybody that's in my audience who is a nurse or a doctor, if you've ever treated a super morbidly obese patient or patients, you would have more to say on this issue. You would have more experience. I'm just, as a reactor, thinking of all the things that might hinder her care. But I wanted to go over these articles and give information to her or anybody else from her channel that might be interested to know things that Chantal really needs to think about when she's thinking about the idea of how wonderful it would be to be bedbound. So let's go over the first article. Just stuff that I quickly pulled up. Okay. So let's see. Look, all this stuff. Let's talk about transportation. Clearly, the morbidly obese patient requires additional or special transportation assets at home or care facility, large chairs, litters, or stretchers, evacuation devices or sleds, or other transport devices must be available. Movement to the ambulance requires special transport stretchers, which need to accommodate a variety of patient positions. Even loading the patient onto the vehicle may require special ramps or winches. The special equipment is expensive, and the additional manpower and time needed to move these patients can be significant. For example, 22 firefighters and EMS personnel reportedly took 2.5 hours to move a woman weighing 34.7 0.4 kg out of the narrow doorway of her townhouse to the ambulance. Y'all give me a second. Let's see. What would that, let's see, pound, okay. What is that? Kg to pounds. Sorry, I'm not familiar with kg. Okay, 347. Okay, so I just did the quick math. I just pulled up the converter, kilograms to pounds. So it took firefighters almost 3 hours to move a woman who was 765 pounds. Now, I'm not sure of how much Chantal weighs exactly. I'm thinking it's somewhere in the neighborhood of 550, if not more. She's put on a significant amount of weight. So 347 kg is 765 pounds. And Chantal, you're almost at 600 pounds. If you're having a medical emergency, the longer it takes for medical personnel or firefighters to get to you, to get you out of the house, get you onto an ambulance, and get you to the hospital, Every second is critical, absolutely critical. So going back to the article, let me see here. I have to see where I'm at. Sorry. Okay, there we go. External resources, including ground and air vehicles, all have specific weight and load restrictions, some of which may further affect movement depending on weather conditions. Bulkier and heavier patients put additional strains on vehicles and even require more fuel to carry the increased load. In addition, just because of their size, additional equipment, and extra support persons, there is less room for non-obese patients, therefore increasing the evacuation needs, such as more vehicles, aircraft sorties, and so on. Normal evacuation procedures also need to be altered with innovative solutions. A patient weighing 495 kg required transfer from a rural community hospital to a care facility for an apparent acute abdomen because normal vehicle and transport devices had only 382.5 kg capacity. The community provider solicited the help of the state's National Guard. My goodness. My goodness. The patient was then transferred in his bed to the large CH-47 Chinook helicopter. Chantal, my goodness. Do you get it? The bigger you are, the more time is needed to find the right vehicle to transport you. Let's see. Going on. Ideally, emergency medical plans would include vehicles capable of managing these patients. They should be comfortable for the patient, accommodate the increased support persons needed, and ease patient movement without causing lifting injuries. However, the challenge is that such a resource would be expensive to purchase and maintain, expensive to equip, staff, and train, and in short supply. And this goes for hospitals. This goes for nursing facilities. This even goes for private care. Because even if you're bedbound at home, you're not in a hospital, and you are a super morbidly obese bariatric patient, you're going to need all kinds of special equipment. You're going to need a special bed, one that's perhaps automated to help lift you up. Because without that lift, it's going to be harder for, say, a nurse or a few nurses to lift you up safely. You might need a lifting bar. You might need a special wheelchair. You might need all kinds of stuff. That sounds really expensive to me. And I just can't see Salah, especially equipping the apartment just for Chantal if she becomes bedbound. It sounds like a really expensive, difficult process. Let's see. Given the requirements and restrictions in moving obese patients, pressure-induced, I can't pronounce this word, rhabdomyolysis may occur, although rare is a well-described complications of bariatric surgery, and thus the complication could occur not only in the operating room, but under similar circumstances in which patients are immobile for prolonged periods during transport. Acute apartment syndrome might also develop as a consequence and is difficult to diagnose in already compromised extremities or if the patients are sedated and cannot provide adequate history of pain. Let's see. Looking. Just looking for more information here. Let's see, disaster triage and allocation of scarce critical care resources. Although obese patients may require increased support and resources, especially in a disaster setting, with appropriate planning and accommodation, most needs can be achieved through surging capacity of staff, and space. However, depending on the disaster and resource availability, tough triage decisions may be required where there is simply not enough resources to support all in need. Given the additional resources, challenges, and scope of the problem in managing morbidly obese patients, under normal daily circumstances, there may be an inherent negative stereotype afforded to these patients. Let's see. Blah, blah, blah. Looking. Okay, back to summary. Management of the morbidly obese patient under normal circumstances requires increased resources such as personnel, supplies, and special equipment. In the often resource constricted settings of disasters, normal support to these patients may be jeopardized. In addition, their underlying condition with limited mobility and comorbidities may increase their likelihood of suffering harm depending on the type and tempo of the disaster. Morbidly obese patients are a special needs population for whom necessary planning must be done to mitigate the effects of the disaster on them. So it sounds like no matter what Chantal does, no matter where she goes, whether it's a hospital, a nursing care facility, or her own home, more of everything is going to be needed, and her lack of health is just going to make it more difficult. You're going to need more of everything, Chantal. More nursing staff, which could be very expensive, more equipment, which could be very expensive. You're going to need trained staff around you that know what to look for, because when you have someone who's bedbound, whether they're obese or not, you have to be on the watch for things such as bed sores or skin infections or skin breaking. Given the fact that you're a diabetic and wounds are slow to heal, somebody's got to be there to make sure that those wounds don't get infected, don't turn septic. Salah doesn't not know. He knows nothing of that. He's not going to care for you in that capacity. He's not going to bathe you every day to make sure that your skin stays healthy. He's not going to move your limbs around to where they won't become atrophied. You need a care professional for that. So there's that article. Let's move on to the next one. Let me see here. Okay, so me just looking. Sorry, I've got several things pulled up here. Give me just a moment, please. Okay, look, we got another one. Trying to find StreamYard. Sorry if I'm taking a bit of time. All right. Okay. This is interesting and very informative. Okay, nursing care. Physical size can complicate even the most basic nursing interventions for obese patients. Skin care, respiratory challenges, assessment, and resuscitation measures, altered drug absorption, intravenous access, and immobility can pose nursing concerns. Obese patients face numerous challenges in maintaining their skin integrity. In obese patients, tubes and catheters can burrow into the skin and soft tissue. Further skin erosion can be prevented by repositioning tubes and catheters at least every 2 hours. Well, that doesn't sound like much fun. That doesn't sound romantic. Having a catheter or a tube repositioned every 2 hours. This repositioning, however, is difficult for patients who are immobile. Vendor representatives, supply officers, and or equipment liaison persons may be able to locate specialized equipment to manage some of these threats. Excessive moisture accumulation in skin folds promotes bacterial, fungal, and viral growth, leading to intertrigo and potential skin breakdown. Obese patients often present with atypical pressure ulcers as pressure within skin folds is sufficient to cause skin breakdown. Wound healing is problematic because blood supply to adipose tissue is usually compromised, which diminishes oxygen and nutrients necessary to prevent breakdown and promote healing. Each situation is exacerbated if the patient lacks protein, vitamin, or mineral stores, or has a wound within a skin fold where excess bacterial, fungal, or viral contamination and moisture can accumulate. Let's also add in the fact that Chantal is a diabetic. and all of her wounds are very slow to heal. If you guys remember a while back, she had a boil on her back or a boil in general, and that took forever to heal. And Pete's had to help her with that. He had to blow dry the wound and keep the wound clean for Chantal because she could not do it herself. So, being bedbound, Chantal, sounds like there's a lot to be concerned with. And whoever the caregiver is, whether it's professional or someone at home, these are things they're going to be had to be on the lookout for. So you become bedbound, your skin may break down. You might get wounds just based off the fact that you're not moving. And you're a diabetic too. Respiratory challenges. Several mechanisms have a negative effect on respiratory function in the presence of obesity. The most common abnormalities are reduced expiratory reserve volume and functional residual capacity. Studies have suggested that increased pulmonary blood volume leads to congestion, which results in thickening of the airway wall, thus reducing the size of the airway. Well, I'm not a doctor, but we do know that Chantal, she has trouble breathing. So don't know if that has anything to do with it. Clinically, 10% of morbidly obese patients have severe respiratory impairments, such as obesity, hyperventilation syndrome, while over 50% have moderate or severe sleep apnea. Well, she does wear her CPAP. Even if she were to lose weight, she'll probably always have to use her CPAP. And let's see. From a nursing care perspective, the patient with the OHS often breathes better in the semi-Fowler's position because abdominal fat is diverted from the thoracic cavity. A number of patients at home use a continuous positive airway pressure CPAP machine. It is essential that those managing the needs of the hospitalized patient are aware of the patient's home treatment practices. Further, depending on policy, some facilities request that patients bring their breathing equipment into the facility for evaluation or even use. So Chantal has a CPAP machine, and I had a former roommate that he also had a CPAP. And the thing with a CPAP machine is you have to be on top of how clean a CPAP machine is. Going to make sure that the machine itself is continuously clean, that the water is clean. It can't be dirty in any way, because if you leave it dirty, you're breathing in that dirt, you're breathing in that bacteria. That could lead to getting all kinds of sick. Plus, with a CPAP machine, periodically, you have to take it in to have it recalibrated. I don't think Chantal has done that. Let's see. If a long-term ventilator support becomes necessary, the needed tracheostomy surgery can be especially challenging when the trachea is buried deep within fatty tissue. That's something that I've heard from different people who are medical professionals, that if somebody is having a medical event and they are severely overweight, it can be challenging to put the breathing tube down the throat because of the extra fatty tissue. Let's see. In assessing obese patients, a blood pressure cuff sufficient to fit the patient comfortably is essential. Whether the hospital chooses to provide a thigh cuff because it is larger and fits properly around a larger arm, or a wrist cuff to fit around the lower arm area, which seldomly accommodates fatty tissue, the objective is to use a cuff that accommodates the patient properly. Using a cuff that is too small or taping the cuff together to attempt to make it fit will lead to an inaccurate reading. So if you're someone and you are bigger in size or super morbidly obese, like every little thing becomes more difficult. Giving you intravenous fluids, drawing blood, trying to find a vein, taking your blood pressure, every little thing takes more time, becomes more difficult. And if you're having a medical emergency, this can be quite crucial. Altered drug absorption. Excessive body fat might alter drug absorption depending on the medication. Additionally, the dosage of some medications is calculated using the patient's actual body weight, while the dosage of other medications is based on ideal body weight. Trying to remember which drug falls into which category is nearly impossible. The clinical pharmacist is an essential member on the healthcare team to assist in making these critical decisions for your obese patients. It is also important to consider the length of needles used for intramuscular injections, because a standard 1 to 1.5 inch needles may not be able to penetrate past adipose tissue in a patient with a thick layer of fatty tissue. A longer needle may be necessary. Again, does that sound romantic? The doctor's got to use a longer needle because they got to get down inside the body where they need to be. Yeah, not romantic to me. I think I'll pass. Immobility. Most very overweight patients are at risk for certain hazards of immobility. Common immobility-related complications include skin breakdown, cardiac deconditioning, deep vein thrombosis, muscle atrophy, urinary stasis, constipation, pain management problems, and depression. Immobility also contributes to pulmonary complications such as, I can't pronounce that word, and pneumonia. The obese patient is more inclined to develop these complications during a long hospitalization. Specific tasks such as moving and lifting immobile patients uh, can seem overwhelming without proper mentoring and equipment. Ceiling lifts with properly fitted lifting and turning bands, portable lifts which aid in standing or walking an unsteady patient, a sliding board, slip, or inflatable transfer device, and more can be invaluable to nurses who are trained on their proper usage. As technology advances, so does the need to pursue opportunities to learn more about products that provide safe and confident patient care to those of all sizes. So you being almost 600 pounds, Chantal, is not just a problem for you, but it's also going to be a big problem for anybody who takes care of you, whether it's a at-home caregiver or a caregiver or nurse or doctor in a hospital. It sounds like wherever you go, you're going to need special equipment of all kinds, wheelchairs, special lifts, stretchers. If you have a medical event, they're going to need a bigger ambulance or a fire truck and firefighters to lift you, because most people, they're not strong enough to lift 500, 600 pounds, not without hurting their backs. I'm dealing with a situation right now where I don't even know what I did to myself. I pulled a tendon in my shoulder, and believe me, it hurts. And if you're a nurse or a doctor and your job is to provide care to others, you don't want to get injured on the job. You want to continue to do your job safely so that you could treat more patients. So when someone like yourself comes to the door and you are at an excessive weight, there is a chance that not only are you going to be injured, but anybody treating you, if they're not careful, they could also end up injured, and nobody wants that. No one. Nowhere. Okay, what else do we, let's see. Okay, this is interesting. Let's bring this up. Another article. Like I told you, we're full of information today. Chantal needs to understand all of this, that it's not what she thinks it is. Okay. All right. All right. Let's talk about the pressure ulcers. Patients with obesity may be immobile or difficult for staff to turn and position. These patients are at increased risk for developing pressure ulcers. Poor circulation of oxygen to fatty tissue is also a factor that can make patients with obesity more vulnerable to pressure ulcers. Because pressure ulcers may be a hospital-acquired condition, perform a thorough skin assessment upon admission and document any ulcers with accurate descriptions, measurements, and pictures. Now, those of us that have been around in Chantalverse long enough, we've seen her legs. And although we are not doctors nor nurses, we've seen the patchy areas on her leg, and it looks like diabetic dermopathy, which is serious. It is serious. If she corrected her diet, maybe that could be helped, but she's already got certain things going on. But if she becomes bedbound, that could get much more serious. Frequent repositioning using additional staff or mechanical lifting devices and using a bed with a pressure reducing mattress may help reduce the risk. So, again, more special equipment, more people needed to help move you around, Chantal. And the thing is, Chantal, you don't like being around people. You get easily embarrassed with people being around you. But if you become bedbound, you're going to have people around you more than just Salah. He won't be able to do this by himself if he does want to do it. At your size, you're going to need additional nursing staff just to shift you around in bed and give you a bath and do things. So you, as someone that you shun society and you don't want people looking at you, how are you going to feel if you are in a nursing facility or a hospital or even at home and there are people around you that are just trying to help you with the most basic of things? Let's see. Fall precautions. Patients with obesity can be at increased risk for falls due to several difficulties: limited mobility with balance, gait, or transfer issues, current illness, medications, or associated comorbidities, such as cardiovascular, respiratory, or musculoskeletal conditions. So we got to have people that are make sure that you don't fall, or even anybody helping you, they don't fall and they don't sustain an injury. Because if you fall, somebody might fall with you. Like, all of that has to be considered. Patient care areas require equipment designed for patients with obesity, including oversized furniture, scales, MRI machines or tables, beds, wheelchairs, and gurneys. Approximately sized supplies such as blood pressure cuffs, bandages, gowns, and extra long needles are also required. Infrastructure changes may be needed as well. If possible, design patient rooms to accommodate patients with morbid obesity. As example, floor-mounted toilets typically support much more weight than wall-mounted toilets, and doorways may be enlarged to facilitate sufficient clearance for wider wheelchairs and gurneys. Goodness gracious, it sounds like a lot. The hospitals and nursing facilities, it sounds like a lot. Speaking of that, Chantal, do you know, or would you like to know, that if something does happen and you become bedbound and Salah decides that he does not want to take care of you, he doesn't want to take care of you at home, he doesn't have the capacity to take care of you, it's sometimes difficult to find a nursing facility that will take you in. Some of those nursing facilities, they are not properly equipped with the right equipment to deal with a super morbidly obese patient. They don't have the special beds or the wheelchairs or whatnot. And getting all of that stuff would be extremely expensive to them. Likewise, on top of the equipment, they would need additional staff, which would be more expense out of pocket. So if Salah doesn't want to take care of you, or your family doesn't want to take care of you, and your only choice is to find a nursing facility, you might have trouble finding one of those. They will sometimes refuse people who are super morbidly obese because they're just not set up to give you the proper care that you need all the time. Just think it over. You're counting on people to take care of you. You're thinking that somebody's always going to be around you, but will they? Your situation is not just physical, it's medical. You would require a lot of medical care, a lot of special things, expensive things, of which you cannot provide for yourself. So you're looking to Canada or Kuwait to take care of you. They may not. They may not have the capacity nor want to take care of you. You're not even a citizen of Kuwait. You're not even in a position where you are at home in Canada with your family so they can make the proper phone calls and find a place that will take you in. And they don't have the money to take care of you. So, like, is this whole thing of romanticizing being bedbound wise to just lean into that. I think you need to lean away, not lean towards it. Okay, next article. We're going to keep going. We are going to keep going. Did I get this one already? One moment. All right, I think this is the last one. I'm not sure. I've got several things all lined up here. How about this one? Okay. Radiographic limitations. Increased patient body habitus may compromise radiographic image quality. Obtaining an adequate studies of obese patients may require modification of standard imaging techniques. In a 2006 review of radiology reports from a 15-year period, they determined that abdominal ultrasound was the imaging modality most limited by patient obesity. To overcome the attenuation of the ultrasound signal by excessive adipose tissue, the lowest frequency probe should be used. Obesity may impair the quality and exposure level of plain radiographs because X-ray beams must travel a greater distance to penetrate the subject. Longer exposure times and the introduction of motion artifact are common. Obtaining diagnostic quality X-ray images may require technical adjustments such as increased film speed and imaging settings. So just doing simple tests are more difficult in a situation like this. Oh, Lord. So like getting an MRI, getting a CT, the extra weight makes it more difficult, much more difficult. You know, some hospitals are set up for it, sometimes they aren't. Obesity may complicate or altogether prevent the administration of radiation therapy indicated for certain cancer types. The maximum weight capacity of a standard radiation treatment couch is 440 pounds. So you're over the limit, Chantal. Not saying you have cancer. I'm just saying for that, you would be out. To deliver radiotherapy to heavier patients, a treatment couch may be modified with the addition of a commercial lift device with a higher weight capacity. Like there's so many challenges when you're a doctor dealing with an obese patient. As the population of obese patients increases, hospitals will need to adapt to accommodate larger patients. Simply providing larger beds and transport devices for use with the obese patients is not feasible. Bariatric specialty equipment with high weight capacity and mobility aids should be installed and used for the safety of both patients and healthcare workers. Patient care algorithms developed for bariatric surgery programs provide useful guidelines for the proper care of all those patients in the acute care setting. I'm looking for the part with this is interesting. I didn't even know this was here. So here's a picture right here of some of the things that are used for people who are perhaps bigger or super morbidly obese. Special wheelchairs. This wheelchair is 700 pounds. This one for 450. A bedside commode that goes up to 500 pounds. A shower chair up to 700 pounds. A bariatric walker. A sideboard. These are all things that either a hospital or a nursing care facility or even at home you would need for somebody of Chantal's size if she becomes bedbound. An easy lift, maxi move lift, a recliner, special chairs. None of this looks cheap to me. None of this looks cheap. So here's the essential list. Wide beds, standard to 440-pound capacity, low air loss mattress, automated, lifting, transferring equipment, wide commodes, wide wheelchairs, stretchers, walkers, wide blood pressure cuffs, oversized sequential compression devices, biphasic defibrillators, sorry, I'm mispronouncing these big words, emergency airway equipment, wide entrance doors to patient rooms and bathrooms, floor-mounted or reinforced toilets, elevators with wide doors and adequate weight capacity, words, ambula, doggone it, I hate big words, ambula, ambulance facilities, whatever. Wide examination tables bolted to the floor, wide scales with extended weight capacity, wide waiting table furniture with extended weight capacity, operating room, automated wide operating table with extended weight capacity, lifting, transferring equipment, extra long instruments including retractors, laparoscopes, trachars, weight appropriate equipment in PACU and preoperative holding units, radiology, high weight capacity, CT, MRI, and IR facility within a 60-minute radius. Recommended wide beds to accommodate up to 880 pounds, ceiling mounted transferring equipment, designated operating room with ceiling mounted transferring equipment, high weight capacity, CT and MRI, 600 pounds on site, dedicated on-call lift team, facility additions following the American Institute of Architects guidelines for weight loss surgery centers. So this is all the stuff that hospitals and facilities have to deal with somebody who's super morbidly obese. Sounds like a lot. They have to go out of their way just to have this special stuff so that everybody's safe and the patient is safe. The economic implications of hospitals treating an increasing number of obese patients are extensive. Expanded weight capacity equipment typically cost 25% to 100% more than standard items. Building renovations may cost hundreds of thousands of dollars. Injuries to healthcare workers while treating obese patients are another source of financial impact. A back injury claim could cost up to $500,000 in wage replacement and treatment costs. In response to increasing reports of injury by hospital employees, some hospitals have hired and trained lift teams that are readily available to transfer and transport obese patients. You hear all that, Chantal? Do you hear it? Do you hear it? Yeah, not exactly a walk in the park, my girl. Not exactly a walk in the park. It's not what you think it is. It's not going to be what you think it is. Okay? Whatever way you choose to be bedbound, it's not going to be fun. It's going to be expensive. If you're having a medical emergency of some kind, it takes longer for the staff to get to you, to treat you. Every second counts. Every bit of health counts, and you have no health. You have no health. And financially, you are not set up to even get the bariatric care at home. You don't have the money for all the equipment and the special beds and commodes and all that. So you might want to back away from this whole idea of being bedbound. Don't you think? Yeah, I think so. So there's some information for y'all. There's some information on if she decides to go down that road of being bedbound, what she has to look forward to, what the hospitals have to deal with, what the staff has to deal with. It's a lot, isn't it? It is. But I want to put that in front of you guys. You guys tell me your thoughts in the comments. So I hope you've enjoyed this educational video. And if you liked it, you got any comments? Anybody's a doctor or nurse, if you've ever dealt with a super morbidly obese patient, like some of the difficulties with that, let me know in the comments. I'd be happy to learn more. So I'm out. Hope you guys have a great day and take care of yourselves. Bye.